Hi, I'm Dr. Bob Payne with South Kendall Animal Clinic. Let's talk a little bit about caring for your dog after surgery. It's very important to watch the vital signs of your dog post-op. Sometimes they don't breathe as well, sometimes they have been intubated with the gas, and so their throat's a little sore, so they'll cough a little bit. If the coughing lasts more than a few days or a day or two, then you should call your veterinarian. Often they're in pain, so make sure they're given pain medication, make sure they're kept alone from disturbances like children running around, because they may be a little bit sore and a little bit less tolerable to that type of excitement. They may be a little in pain, so don't let them walk around too much. Let them go to the bathroom and come home, or come back inside the house and rest on a nice, quiet, soft area. Small amounts of food and water initially, because their stomach is obviously been stressed, and they may have a little gastric reflux. We've found recently that a lot of these dogs have regurgitated a little bit post-operatively or during the surgery. They have what we call esophagitis. So esophagitis can be treated with a little Pepsid if you have it, but be careful, because they're not going to be normal for 24 to 48 hours. So the first 24 to 40 hours, keep them very warm, keep them very quiet, monitor their respiratory rate, their temperature, make sure they're above 99 to 100 degrees, make sure they're urinating and defecating, and make sure they're not having any problems breathing, because sometimes their lungs haven't replaced back to normal, gone back to normal after they've been anesthetized. Because sometimes when your lungs are anesthetized, they deflate and they don't expand for a day or two. That's why you breathe when you're post-operatively in a human hospital. They give those little wind things that you blow into that we can't do with dogs. But you can monitor their respiratory rate, they can monitor their temperature, and you can monitor their eating and drinking habits. And you can look at their gums, make sure their gums are nice and pink. You can lift the gum up and press them and make sure the refill time is within 1 or 2 seconds, 3 seconds after you press down on it. Anyway, monitor the quality of breathing and eating afterwards.